National Institutes of Health has quietly resumed some of its activities that were put on pause by President Trump. The acting Secretary of Health and Human Services ordered a blanket freeze on all external communications last month. But the NIH has started reviewing research grant proposals in closed meetings. Hiring research trainees and recruiting study participants remains on hold.
We've been talking about it all morning long. Just moments ago, the state released new flu numbers, and it's clear a flu surge is hitting North Carolina. WRAL health reporter Grace Haba joins us now. And Grace, we are seeing more children with the flu now.
That's right. Very, very sick children. That's how one pediatric doctor right here in the Triangle is describing the patients he's seeing come in for treatment amid what he's calling a very intense flu season. As you mentioned, the state just updated its respiratory totals just a few minutes ago, and it shows hospital visits for the flu more than doubled in the past month. That virus now makes up 11.8% of all emergency room visits. Nearly 1,500 patients are now being treated for the flu statewide. Now, this is when we expected to see flu cases rise in our area, but one doctor with UNC Health notes that the increase we're seeing is particularly high this year.
The timing is very similar to pre-2020 flu numbers, although the amplitude or the height of the curve is a lot higher. So we are seeing more cases this year than we did see prior to the pandemic.
66 more people have now died from the flu, and that brings our state total to 117 so far this season. None of those patients have been children, and the majority of them have been over the age of 65. Now, as for COVID and RSV, there is a bit of good news to report there. It does appear that both of those viruses have peaked for this season, and in fact, COVID is actually much lower compared to where we were at the same time last year. So, Renee, a little bit of good news there.
Grace, thank you. Right now, 5 people in North Carolina have tuberculosis. Numbers from the state show cases have increased in recent years, with 250 cases in 2024, up from 195 in 2014. Experts believe the spike is a result of COVID, in that that's when people miss preventative screenings. However, they add this number is no cause for alarm, just awareness. More than 75% of cases originate outside of the U.S. and are transmitted often in indoor spaces with a lot of people.
And